Have you ever heard of Qigong? Well, today we're going to learn more about that. Welcome to the Crack the Code podcast. And today we're going to be welcoming Dr. Amba. She is a doctor of medical Qigong therapy who did her undergrad work in holistic health, biofeedback, psychology, brain development, Western and traditional Chinese medical sciences at several colleges and universities in San Francisco and Monterey Bay areas. Her focus is on women's community building, self-care, and self-love with her retreats with other wellness-wise women collaborators. She's a thought leader, speaker, author, intuitive clairvoyant, healing doctor of Eastern medicine, and a wife, mother, and grandmother who splits her time in Wisconsin and California when not traveling for retreats or speaking engagements where she's promoting her book. So welcome, Dr. Amba.
Hello.
So excited to have you on the show because this is something we have not talked about yet, Qigong, and we're really interested to learn more about it. So
Yeah, and
maybe,
when people
yeah.
say Qigong, they usually mean the general exercises that, you see people looking like they're doing Tai Chi, which Tai Chi is a form. But
Okay.
Qigong is, some people can teach Qigong for exercises. I practice medical Qigong, which is a
Ah.
modality of traditional Chinese medicine.
Oh, awesome. I didn't realize there was two sort of different types. So that's good to know. Maybe you can just give us a little bit of background. How did you get into it? What even got you started in that road?
Well, I had a couple big transitions in my life, losing my mother in that same period of time. I lost a baby. I was had a miscarriage, went into a really deep despair and depression, and happened to have studied Qigong for teaching the general health with a group of people who are based in Florida. And I actually studied with Wim Hof, who did the Wim Hof method. Now he calls it. He used to call it the Tumo because it's originally a Tumo meditation out of Buddhism. And I realized that the holistic health way was better to go than the Western way for, medicate, 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 which I believe often is band-aiding situations rather than help you heal. And I got into a program with Dr. Jerry Ellen Johnson, and that really totally changed my life, and the lives of everyone who did that doctoral program at the International Institute of Medical Qigong. Um, and that's how I started. And actually, at the Holistic Health Institute at San Francisco University, there was a teacher, Cynthia Chang, who taught Chinese holistic perspectives. And I saw a video of medical qigong before I studied with Dr. Jerry Ellen Johnson, and I said, "Oh, that's what I'm supposed to be doing." I saw these people shrinking tumors. They had the biofeedback, literally on camera, you watch them shrinking tumors. And I ended up focusing on breast cancer as well for
Oh,
my research.
oh. So how does the Qigong actually work? Tell us a little bit more about how that process works.
Well, it is very much integrated into the spiritual life of a person and their emotional life. So you are Miss Crack the Code with emotions. And I love it. I love how you very detailed go into the emotions. And that's really what we do with medical Qigong as they relate to the five yin organs. So we have the solid organs, the heart, the spleen, the lungs, the kidneys, and the liver. They all relate to the whole body. They have different things in Chinese medicine that they relate to, and they relate to different innate virtues we're born with, like heart, joy, tranquility, and order, and the acquired emotions like anxiety, nervousness, expectations not met, or to a deeper extent, despair and depression, which a lot of people who have generalized uh, depression, they can do these practices because they are prescription meditations, like guided visualizations, sound, movement, with the intention of the brain telling the body, every cell, every tissue, how to honor those uncomfortable emotions and remove them from the physical tissues. That's a huge part of manifesting too, is getting up to a higher vibration so you can manifest things after you let go in a healthy way of these uncomfortable emotions and cultivate the innate virtues like joy, tranquility, and order in the heart. So that is part of it. And when I work privately with clients, we go into old stories just a little bit. And forgiveness work. Huge part of it is forgiveness work. And when we do the retreats, it's just a general touching on tools, because all of the tools are different meditations and exercises with intention, attention, imagination, sensation, that really help these exercises remove toxic energy from the cells of our body and from our brain and our patterns that were not serving us well, and really helping us be more in alignment with why we came here. The work I do is usually, not always, but usually with people on a spiritual path who want to grow and evolve, more in alignment for why they're here, and to really honor, as a gift, to grow and evolve, cancer or diabetes or heart or kidney disease, or the end of a marriage or a transition that's big in a life.
Yeah. So is that what people usually come for, like a specific ailment or like going through something big in a
Well,
big change?
private clients, yes.
Yeah.
It's usually a health concern, or I work with mental health issues like
Mhm.
PTSD, bipolar disorder. I have not worked with a schizophrenic um, client with that diagnosis. We definitely have a different perspective of um, mental health than um, than we have in Western. We in mental health, it's really divided into two categories: bipolar, schizophrenia, one category; everything else is in
Yeah.
another
Yeah.
category, because it's
Yeah.
much more brain
Yeah. Some
chemicals
things
and
are just a lot
biology.
more sort of trauma and involved in some of those
Yeah,
things. Yeah, for
yeah.
sure. Oh, that's super cool. And so then now you're doing a lot more work getting into doing retreats. So how did you go from doing your sort of private practice more into working with women and doing retreats?
Well, I am a proud member of the Polka Dot Powerhouse, which you also
Hmm.
are,
Hmm.
the women's organization. And when COVID happened, we started doing these meetings. We have chapter meetings, and we could go visit them virtually. And so I met these wonderful women in other parts of the country and in Europe. And I said, how can I see these ladies? I want to meet them and hang out, not just for an hour. So I started doing 3-day, 4-day, and 12-day retreats with these polka dots in wellness, um, sharing their tools. You came to one retreat
Hmm.
and
Hmm.
spoke in New Mexico, and yeah, just got into it because mostly I wanted to have fun hanging out with other women who are supportive and want to support other women, and it helps showcase other women and their coaching or their practices, or even just some of the polka dots will tell a story that was hard and how they overcame it, to share self-care and self-love tools. And that's what the retreats are called, Dr. Amba's self-care and self-love retreats. And mostly they're about socializing and getting
Yeah.
to know
Yeah.
each other. The people in person a little more. The people that are on virtual Zoom, they just have the periods of time that we connect virtually, but we do a lot of breakout rooms and fun games. So
Yes.
it was really selfish. I just wanted to travel and hang out with these ladies. And I'm 56 this year and kind of scaling back my private practice and focusing on travel and fun.
Yeah, and if anyone ever gets the chance to go to one of Doctor's Amba's retreats, I highly recommend it. She is quite a character, and she's an amazing singer as well. So you get quite a bit of entertainment.
Yeah. And that's
And
my gift to everybody too, is that this year the women could come for free to one of the virtual retreats of the 5 that I have every year.
nice.
So,
Oh, that's amazing. That's an amazing offer. And all that information will be in the show notes for people that want to join along. And I think you had a sort of a plan because you did quite a bit of traveling in your past as well, have you not?
yes, as a jazz singer, from 18 to 27, I was in Europe, all over, mostly Amsterdam, Zurich, and Nice. And our Swiss retreat in September is actually in Switzerland, in the German uh, part of Swiss German part of Switzerland.
Cool. And that's kind of your plan, is to be able to travel and do your retreats while you're moving
Yes.
around the world.
Yes,
Oh,
and because I've been there as a jazz singer, we're not going to be in the big touristy areas. We're going more on the
mm,
kind of back roads, and definitely a lot of mountains. That's about
nice.
the most wonderful thing, lakes and mountains in Switzerland. And that's the only place we don't have a polka dot chapter, but we do have a UK chapter and a worldwide one. So people can attend virtually. And it's 12 days, so people can come for, 3 days of that 12 days at different times. But
Mm.
whenever they come, it's going to be fun.
Yeah, I know there's a lot of women our age that are looking for travel, but also the retreat part. It's kind of a fun mix to have all of that mixed in together. Now, I know
Yeah.
one of the things that you're really passionate about is positive self talk. And that's one of the
Yes.
things you often speak about. Maybe you can tell us a little bit more about that.
Yeah, well, I did study positive psychology with Dr. Robert Lutz, and it was before I studied medical Qigong. And I
Hmm.
realized that they are the same in the respect that we, with medical Qigong, are honoring the negative, emotions we have, but we're recharging the positive virtues like joy, tranquility, and order. And when we do guided meditations or the meditations, we're telling our brain this, focusing on bringing in joy, tranquility, and order to the heart, focusing on fire element, focusing on, pink flowers around us, nature's integrated. But we're talking positive, bringing this in and really telling the brain, this is what we're doing. With positive self talk, you're telling the brain, this is what I believe. And every cell in our body hears and believes it. And it affects your stress levels, which we want low. So we don't have inflammation anywhere in the body. And it feels good, right? To
Yeah.
feel less stress or no stress. And the positive self talk is really noticing when you find yourself saying anything in the negative and either saying cancel, 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 or, packing up and saying instead of, oh, I can never lose weight, I am so bad, rather saying magic words. Even though in the past I've had trouble losing weight, I still want to lose weight with grace and ease. And that's way to like crack open the mafia mind of the brain so that there's a, oh, well, that's impossible maybe for me to think I am losing weight easily, to, oh, even though in the past I wasn't able to, I still want. That's cracking open the subconscious door so that you have the possibility. And then there's the whole, I am a successful entrepreneur. I am, rather than, oh, I should have done this yesterday.
Yeah.
And rather than shooting on yourself,
Hmm.
saying that more and more I am getting really good at accomplishing the lists of things I need to do. And before you go to bed, saying the accomplishments rather than the to-do list for the next day, rather say the accomplishments of the day you already had. Things that are positive, and looking in the mirror and saying, I love you so very much. That is a hard one for some people. I
Yes.
know, like, different people say, I love and accept myself just the way I am. I prefer not to use that because that is low vibration. Like, accept means, well, there's something wrong with you and I'm
Mm.
accepting it. Just like with gratitude and appreciation, there's a different vibration. So there's a lot of things to talk about with positive self-talk, and just noticing when you are speaking to yourself in a negative energy, a negative talk, and switching it. You can do this, the three C's: commitment, challenge, control. I am committed to having a healthy body and having a healthy mind, and I rise to the challenge, and I am in control of how I choose to see things. There's millions of tools around self-talk. I try to share different tools and different talks. I do a lot of public speaking. So I love to have anyone come to anything. You'll see the events and things at sitwellness.com. Sit and meditate, not medicate. That's my
Mm.
philosophy.
Oh, I love that. I tell everybody, and I mean, I've really been, interviewing a lot of women that are in different types of modalities because it's important
Mhm.
to work on the emotional side along with the medical side. Like if they worked a little bit more together, I think it would be really great because you're not going to get
Totally.
necessarily everything from one person. And if we
No.
could
Yeah.
synchronize that, that would be so powerful.
Yeah. And that's the
Yeah.
big reason I have other speakers on my retreats, because all these different coaches and people are offering something slightly different or very
Mm,
different, and not every person connects with every person. Like, I
yeah.
might not be the best person for somebody, but you, Cora, would be awesome for somebody. But hearing them gives them an opportunity to go, oh, I really would like to work or get to know that person better. And that,
Yeah.
like you said, the physical, the emotional, and then the third part I work with is the spiritual. And whatever someone or however someone calls their higher power, that's a very important part in this healing process, that surrender part, that I know that, you know, I am always getting what I it's best for my plan. My trademark is every challenge is a gift to grow and evolve, and that is closer to the divine, closer to our, eternal purpose for being here.
Yeah.
That
Yeah.
spiritual aspect and the community of other women is a spiritual connection. Having more women that support you. That's why I really like the retreats, is because you're making friends. You're finding more people to have on your list to call when you want a friendly voice, or our Facebook group too, that, we can share things and what's going on with us and just have support. That's a spiritual aspect too.
Yeah, and that is so important. And sometimes it's hard to find, like at our age, if you're trying to find new friends, maybe you've gone through a big life event of some sort, you might not have the right kind of supportive friends around.
Yeah.
And people that go to retreats tend to be a certain kind of like-mindedness already, even if you don't know each other before you get there.
Yeah. And it's so true that, we can love people from a distance. We don't have to see them all the time. Fran Lambert, a good friend of ours,
Yeah.
she often talks about, and I think it's someone else's idea, your bus is only so big. Make sure you have positive and supportive people on the seats in your bus. So if you do have unsupportive people, you want to, distance yourself and
Mhm.
add more supportive people in your community.
Yeah, yeah, especially, with your family, they're not always your support people. We don't have a choice who's in our family, but we do have a choice who's in our friends list. So always be on the
Yes.
lookout for that and that community. And you do a great job of creating that community for sure.
Thank
And
you.
yeah, I'm so happy to have you on here today. I'm thinking,
Yeah,
is there
thank you for
any
your I was gonna say thank you for your community as well. You're a wonderful community gatherer and always make people feel so special and elevated. I really appreciate that in you.
Thank you. Thank you so much. So before we head out of here today, do you have any other little tips we can share with the listeners, maybe for finding more of that positive self-talk or something that they can use in their everyday life?
Yeah. Yeah. Well, the big tool that's the easiest one, which actually lowers high blood pressure. So you don't want to do it too much if you have low blood
Mm.
pressure because it's contraindicated. It's so easy just to help your body relax so you can get into a state of a higher vibration and positive, having positive self-talk for better health. And that's the HAA sound. That's the heart sound. So like taking a deep breath, lifting your shoulders and making the high pitch to low ah sound, and really
Mm.
relax your face and jaw and shoulders.
Mm.
Just really deep breath. Ah, smile. And if you do this 10, 12 times, you will have your body reset the homeostatic norm to be in the parasympathetic or rest and digest state and away from the sympathetic fight or flight. So that is a quick tool to get realizing, wow, I was holding my body tight and relaxing. And then from that state, you're already in higher vibration, which is positive.
Mm.
And then from there, after you're relaxed, you can say, what are the emotions I'm feeling right now?
Mm.
And take that emotion and say, okay, I'm honoring it. And if you don't know yet which organ it relates to, you can just take a deep breath and blow it out into the earth, and then breathe in joy, tranquility, order. I keep bringing that up because we made the
Mhm.
ha sound for heart.
Yeah. Yeah.
So, just breathing in. And another quick tool I like to do in the retreats too, excuse me, is write down 5 things you've accomplished in your life that you're
Mm.
proud of,
Mm.
that maybe you don't think about all the time. Maybe being in a marriage for a long time, maybe getting a degree, maybe having made it out of bed and to the store, something
Yeah.
you've accomplished that you're proud of, which is a big deal if you have depression.
Yeah.
So anything you're accomplished in your life, big or small, writing a list, ideally something you don't think about all the time,
Hmm.
5 things, 3 things, putting them on paper and having them in your back pocket to look at, to go, yeah, I did that. I did that. I have accomplished something. And that really helps elevate your state as well.
Yeah. And I know that that's one of the things that most women really have to work on is celebrating. whether it's big or small, every day we have done something that we can celebrate for sure.
Yes.
Yeah. Well,
Yes.
thanks again so much for being with us today and sharing your knowledge and all the things that you do. Super excited. Like people that are listening, if you get a chance to attend one of Dr. Amba's retreats, I highly recommend it. You're not going to regret it at all. So keep an eye out in the show notes. She's got a few coming up this year, right?
Yeah, May, Colorado, August in the Berkshires in Massachusetts, and then Switzerland in September, and November is California, Bodega Bay.
Oh, awesome. So if you get the chance to hop onto one of those virtually and check it out, or even in person would be even better. That would be totally amazing. And now that we can get out and get around again, that would be so awesome. So
Yeah,
take some time for yourself, plan it. As women, we sometimes forget to plan our self-care, and a retreat is a great way to do that. So keep that
yeah,
in mind. And if you're going to do something, plan it, because it's never too late to get out there and do something.
totally. And if you do come virtually, I highly suggest you rent a hotel and stay there the whole retreat away from anyone else so you can focus on the retreat and the
Yes.
activities.
Yes. So important. So keep that in mind and pamper yourself, because it's never too late to do that.